Shante Munker's second pregnancy was progressing as well as her first, until some blood work revealed there might be a problem. Advanced testing showed that baby Elizabeth had not just one, but two club feet, meaning that both feet rotated in at the ankle.
My first thought is she ever gonna walk? My second thought is she gonna have to have surgery?
Shantae's due date came, and she gave birth to Elizabeth at a local hospital. Shantae and her husband Ernie rejoiced over the health of their new baby, but were concerned when they saw her feet for the first time.
I wondered if it hurt her, and I didn't want anybody taking pictures or touching her feet. I didn't want anybody looking at her like she was different.
They were just so odd looking. I'd never seen anything like it. They were upside down and turned in on their side.
The Munkers of Farmington Hills, Michigan were referred to Dr. Walid Yassir, Chief of Orthopedics at the Children's Hospital of Michigan. Dr. Yassir runs a Clubfoot clinic that treats approximately 300 children per year who come from all over the region.
The Clubfoot clinic here at Children's Hospital of Michigan is something that started when I got here about 7 years ago, and I designated Wednesday mornings as my Clubfoot clinic to make it easier for the families. We do have all the resources necessary for them so that they can have one-stop shopping when they come for their visits, and I think that's what really sets our clinic apart.
Elizabeth was 10 days old when we took her to see Dr. Sear for the first time.
He said, okay, let's get started. And he got started that day. I couldn't believe it. I thought we were just there for a visit to where he could determine what was going on, but he jumped right in, feet first.
There are a variety of surgical techniques to treat clubfoot, but Dr. Yassir prefers a non-surgical approach known as the Ponseti method. This method uses a special technique for casting the child's leg over a period of time, followed by a minimally invasive heel cord lengthening procedure and the use of special braces for several years. Dr. Yassir is the only surgeon in Southeast Michigan certified in the Ponseti method for treatment of clubfoot, and is also believed to be the only surgeon in the state of Michigan who actually trained under the late Dr. Ignacio Ponseti.
The goal is not to have a perfect looking foot that's stiff and painful, which is very often the outcome from surgical correction. The goal is to have a foot that fits in a shoe, that the child can walk on and do all activities on, and is pain-free for the rest of their life. That's why I prefer the Ponseti method. Elizabeth got the typical cast treatment, so we cast the children every week for about 4 or 5 weeks until their foot is nicely corrected. We then do that heel cord lengthening, and then we go into the shoes and you wear the shoes full time for 3 months, about 23 hours a day. And then we gradually bring the shoe wear down a couple of hours a month so that by the time the children are ready to walk, they're just wearing the shoes night and nap time. And at age 3, we then will give them a trial off in terms of seeing how the foot looks. And if we see any signs of recurrence, they'll go back into their shoes for night and nap time for about 6 months.
When he first told us that it was going to take 3 years, it was, oh my gosh, that is such a long time. But the 3 years flew by like there was nothing. I mean, it was like a blink of an eye.
She's very nice and flexible. Elizabeth can expect a pain-free foot with great mobility and absolutely nothing else to worry about. She's going to go through life with as normal of a foot as she can have. She's not going to have pain, she's not going to have stiffness. If she wants to play sports, she can do it. If she wants to dance like a ballerina, she can do it. She can do everything she wants.
Her feet are the most beautiful feet in the world. And she gets a little boo-boo on it, and I'm like, oh, we can't let anything happen to those feet. They're better than what I expected at the beginning, because I didn't think he'd be able to do what he did. If you looked at her, you wouldn't be able to tell that anything was ever wrong with her. Can you make a cake?
Elizabeth is doing so well now that I can't keep her inside the house. She just wants to run. She does everything that a normal 3-year-old girl can do. And that's all thanks to Dr. Yassir. It's unbelievable.